This channel serves to educate and inform, yet it doesn't replace expert medical counsel. Remember, your medical queries and concerns should always be directed to a professional. Diagnosis, treatment, or any health-related advice? Seek the wisdom of your physician or a qualified health provider. Let this be a springboard for learning, not a substitute for professional guidance. Dive in, absorb, but always consult with the experts for your health matters.
Do you know what asthma is and how it affects millions of people worldwide? Asthma, a word that resonates with a large number of us. It is a chronic lung condition that impacts an estimated 25 million people in the United States alone. This disease is characterized by narrowed airways and an overproduction of mucus. But what does this mean for the people affected? Well, these narrowed airways and excess mucus make it difficult for air to move freely in and out of the lungs, causing a range of symptoms that we will delve into later. Globally, the impact of asthma is significant, affecting people of all ages, from toddlers to the elderly, and all walks of life. Its reach is not limited by geographic boundaries or socioeconomic status. Asthma is a universal concern, a silent epidemic that is often underestimated and misunderstood. In the grand scheme of things, asthma is not just about wheezing or shortness of breath. It's about the millions of people whose daily lives are affected by this condition. It's about the children who are unable to participate in sports, the adults who live in constant apprehension of an unexpected asthma attack, and the families who must adapt their lifestyles to accommodate a loved one's condition. Asthma is a serious disease, one that requires understanding, management, and the right care. It's not just about treating the symptoms, but also about understanding the triggers and learning how to avoid them. With the right knowledge and tools, those affected by asthma can lead fulfilling lives, unencumbered by their condition. Now that we've introduced asthma, we'll dive into the different types of this disease. Asthma isn't a one-size-fits-all disease. There are several types, each with its own characteristics. Let's delve into the different types of asthma, starting with allergic asthma. This type is triggered by allergens such as pollen, dust mites, or mold. When a person with allergic asthma comes into contact with these triggers, their immune system overreacts, leading to an asthma attack. Next, we have occupational asthma, which is caused by inhaling fumes, gases, dust, or other potentially harmful substances while on the job. Painters, farmers, and people who work in chemical industries are often more susceptible to this type of asthma. Lastly, there's exercise-induced bronchoconstriction, commonly known as exercise-induced asthma. This type isn't triggered by allergens, but by physical exertion. A person with this type of asthma may experience symptoms like coughing, wheezing, and shortness of breath during or after exercise. Each of these types of asthma has unique triggers and characteristics, making them distinct from one another. Understanding the types of asthma helps in identifying its causes, which we'll discuss next. What causes asthma? It's not as straightforward as you might think. Asthma is a chronic lung disease that is often triggered by various elements in our environment. Among these are allergens, which can range from dust mites and pet dander to pollen and mold spores. These allergens, if inhaled, can provoke an asthma attack by causing inflammation and narrowing of the airways. Smoke is another common trigger, and this includes both tobacco smoke and the smoke from fires or heavy pollution. The harmful particles found in smoke can irritate the airways, leading to an asthma attack. Physical exertion, too, can induce what we call exercise-induced asthma. During high-intensity workouts, we tend to breathe faster and through our mouths, which can dry out and cool the airways, causing them to constrict. In essence, these triggers lead to an overreaction of the body's immune system, causing inflammation and swelling in the airways, along with an excess production of mucus. This combination results in the narrowed airways and breathing difficulties characteristic of an asthma attack. Knowing the causes is half the battle. Now, let's tackle the symptoms. Asthma symptoms can be subtle, but they significantly affect quality of life. To understand the impact of asthma, it's important to be aware of its common symptoms. Firstly, wheezing. This is a distinct whistling sound when breathing, more noticeable when exhaling. It's a result of the narrowed airway struggling to let air pass through. Next, there's shortness of breath. Imagine feeling like you've run a marathon, gasping for breath, but you're simply sitting or doing a light activity. That's what shortness of breath can feel like for someone with asthma. Coughing is another common symptom, often worse at night or early in the morning. This isn't your typical cough. It's a persistent dry cough that just doesn't seem to go away, and it can be especially troublesome when trying to sleep. Now, it's important to note that these symptoms can vary from person to person. Some might experience all of them, while others might only have one or two. Severity can also fluctuate from barely noticeable to severe enough to cause a full-blown asthma attack. Moreover, these symptoms can disrupt daily activities. Simple tasks become arduous. Walking up the stairs, playing with your kids, or even just carrying groceries can become a struggle. The unpredictability of symptoms can also cause anxiety, further impacting a person's lifestyle. So, it's not just about the physical symptoms. Asthma can have a profound impact on a person's mental health and overall quality of life. But the good news is, with proper management and treatment, these symptoms can be controlled, and individuals with asthma can lead a normal, active life. Recognizing symptoms is crucial for diagnosis, our next topic. Diagnosing asthma involves a careful review of medical history and specific tests. This is not a process to be taken lightly, as it is the first step towards managing this chronic lung disease that affects over 25 million people in the US alone. Now let's delve into the process of diagnosing asthma. It all begins with a meticulous review of a person's medical history. Doctors consider factors such as family history of asthma and personal history of allergies. They also look into the frequency and intensity of symptoms such as wheezing, coughing, and shortness of breath, as well as their triggers. But a review of medical history is just one part of the equation. To confirm the diagnosis, specific tests are necessary. One such test is spirometry. This test measures how much air you can breathe in and out and how quickly you can blow it out. It's a simple test, yet it provides invaluable information about the functioning of your lungs. In spirometry, you'll be asked to take a deep breath and then blow into a sensor to measure the amount of air your lungs can hold and the speed of the air you inhale or exhale. This test helps your doctor to understand if your airways are narrowed or obstructed, which is a telltale sign of asthma. Sometimes a bronchodilator, a drug to open up your airways, is used during the spirometry test, if your lung function improves significantly after inhaling the bronchodilator. It's a strong indication that you may have asthma. It's important to remember that asthma can be a complex condition to diagnose, as it often mimics other respiratory conditions. But once the process is complete and a diagnosis is confirmed, it paves the way for effective management and treatment. With a diagnosis in hand, we can move on to the most important part, the treatment. While there's no cure for asthma, it can be effectively managed with proper treatment. This is a critical point to remember when discussing asthma management. Asthma treatment primarily focuses on controlling the disease in the long run and tackling attacks when they occur. Asthma medications are typically categorized into two types: long-term control medications and quick relief or rescue medications. Long-term control medications, such as inhaled corticosteroids, help reduce inflammation in the lungs, making airways less sensitive to triggers. These are used daily to control the occurrence and severity of symptoms and prevent asthma attacks. On the other hand, quick relief medications like short-acting beta agonists are used during an asthma attack to provide immediate relief from symptoms. They work by quickly opening up swollen airways that are limiting breathing. In addition to medication, one of the most effective strategies for managing asthma is avoiding triggers. Triggers can vary from person to person, but often include allergens like pollen or dust mites, irritants like smoke or strong odors, and even factors like stress or exercise. By identifying and avoiding these triggers, individuals can significantly reduce the frequency and severity of their asthma attacks. Monitoring symptoms is also a crucial part of asthma management. Regular tracking of symptoms can help identify patterns and triggers, inform treatment decisions, and even predict asthma attacks. Tools like a peak flow meter, which measures how well your lungs are functioning, can be incredibly useful in this process. Working closely with a healthcare provider is key to effectively managing asthma. They can help formulate an asthma action plan, adjust medications as needed, and provide guidance on how to manage symptoms and handle asthma attacks. Remember, asthma management is not a one-size-fits-all approach. It requires a personalized plan that takes into account the individual's symptoms, triggers, and lifestyle. Effective treatment allows individuals with asthma to lead normal, healthy lives. No matter how severe one's asthma might be, with the right treatment and management strategies, anyone can keep their asthma under control and continue to do the things they love. Asthma is a complex condition, but understanding it makes managing it a lot easier. Today we've taken a deep dive into the world of asthma, exploring its different types, its causes, and its symptoms. We've learned that this chronic lung disease, affecting over 25 million people in the US, is characterized by narrowed airways and excess mucus, leading to symptoms like wheezing and shortness of breath. We've also delved into the process of diagnosing asthma, which often involves a review of medical history and tests like spirometry. Finally, we've discussed the importance of treatment, which typically involves medications like inhalers to control symptoms and prevent attacks. Of course, avoiding triggers and monitoring symptoms are key aspects of managing this condition. Remember, while asthma can't be cured, it can be effectively managed. Stay informed, stay healthy.